I do not see any questions in the chat box. So I think is that good news, perhaps, that everything is clear. I think that registries, I think very easy to understand that registries are important to our work. But I think what I'd like to ask maybe Rio is, are there any challenges? For example, you said that there should be consistent and precise definitions. Now, I think that would be easy to achieve if we were like working in one country only, like say United States. But since we're an international group, and perhaps of course we would like to be able to compare results, benchmark with each other. So how easy or how difficult do you think it would be to achieve a consistent definition over many countries?
It took us 2 years in locked rooms where we were not allowed to leave until we were in agreement for the definitions. As such, I think the TTS will take great leadership in getting representatives from each region of the world to come together and agree upon a set of definitions. And we may have to start with a relatively limited or parsimonious set of variables to begin with, at least. And I think it's very important that we all come to an agreement that these definitions are consistent, clear, logically possible, and logistically possible to collect. I think it is not right to presume that every country in the world can collect the level of data that we may be able to collect due to electronic health records, et cetera. But the platform should be able to be accessed with anybody with an internet connection, so that any data set that we allow for has to be of very high value and low intensity. What I mean by that is a high intensity variable is a variable that takes a lot of work to get out. A low intensity variable is a variable that is easy to collect and is accurate. So what we want to do in this room full of experts from each region, each country, et cetera, that wishes to participate in any international registry is an agreement that we're going to be parsimonious as much as possible with the high impact variables, as well as agree that this is what we're going to collect, at least at the beginning, to really establish quality metrics and the ability to risk adjust those quality outcomes.
Well, yeah, thank you for that answer. So maybe what I would like to ask is if TTS leadership is ready to take the lead on this. Oh, anyway, maybe that's a rhetorical question. So I'd like
No. Can I answer you, Benita?
Okay.
Actually, the TTS leadership has kindly agreed to participate with the American College of Surgeons to make this opportunity, this center level opportunity available to all the participating countries and centers who want to do it. So it's a fantastic effort by TTS with Dr. Kontarovich and Dr. Haberl, who have agreed to do this. So TTS and Dr. Gondolese, TTS is ready to do it.
Okay, great. That's good news. Perhaps then, are there going to be, well, I guess like Rio said, there should be some development of some common definitions. Anyway, there's a lot of work to be done, I suppose. So let me read this question from Matthew is at Vice. For Dr. Hirose, could you please comment on the importance of having a clear legal framework that mandates a central registry to collect confidential patient data from multiple jurisdictions within a federal system?
Yeah, in the United States, it's actually carries the weight of law that establish both UNOS and the SRTR as government contractors responsible for data collection. And it is very much in the final rule by the Department of Health and Human Services what the actual metrics need to be. And so it's very much specifically laid out in law that carry the weight of law that the United States transplant centers, if they wish to participate in the transplant system, must submit some of the mandatory data. The transcript we actually rolled out as a voluntary program just to show the value to other transplant centers of collecting more granular outcomes. But I think in each country, a Ministry of Health, for example, may wish to have the legislation to require engagement of the transplant center should they wish to be certified, for example, to perform transplantation, as mentioned by Axel. And I think that each country needs to really think about if they're going to spend this much money and devote resources to to infrastructure to build both organ procurement and transplantation, the data infrastructure must be built at the same time. Because my argument is you cannot afford not to have these data elements being collected because you won't know what you're paying for. Most investors want to know what their return on investment is. How can you know what your return on investment is if you have no idea what the outcomes are?
Yes, you make a very good argument for good data collection. Liliana is asking, how do you achieve adherence to those registries from transplant centers? I think you partially answered that already, that perhaps it may take legislation, but in the US, did it take legislation? You mentioned something about mandatory data. So how does it become mandatory?
Well, back in 1984, a law called NOTA was passed in the US Congress, believe it or not, by bipartisan support to support this. And I'll defer to Axel and others as to how they think that this should be mandated in other countries.
Okay, thank you. Now a question for Axel from Gabriel. Can big data analysis be useful to join the effort of the multiple states, regional, organ-specific databases in which all contribute in order to have a unique, comprehensive data repository?
I'm absolutely sure that combining data can help in certain circumstances. One thing is just the comparison, as we heard, the benchmarking also between countries. But then there are some very rare diseases that can be transmitted that can wire transplantation and donation and transplantation. So I think there also these big data can help. And then there are, of course, all the complex interactions that we were talking about, and therefore I think that is also, there are so many elements that come together to which you can combine from different national registries to learn more. So I think absolutely, yes.
Okay, thank you. And Marta has a comment. I think this is partly an answer to the previous question that making center authorization conditional to data reporting would help meet the data collection goals. I think that's very correct. And then a question.
Let me, can I answer your question, please?
Okay, Riadh, go ahead.
Sergio, you mentioned that you have a strategy or a policy that allow reporting on illegal transplant in hospitals. So how do you get this information about illicit practices? Is it you have inspector? Do you have an executives in these places that give you reports? How do you receive these reports? And are you authorized to investigate it?
Well, yes. I mean, what we have is a very developed information system. So all the actors of donation and transplantation in our country are, they have to upload all the data in our information system because of our laws and because the whole system works like that, both private and public. So normally we get all the information in that system that is very strong. And we also have, as an agency, the possibilities to oversee if we get to know that there are some irregularities, we can do inspections or whatever it takes. Yes.
Sergio, if I may, Riadh, as a transplant
Sure.
center, I mean, from Argentina, it's proud for me to say that the Incucay model is an example for all Latin America, and the regulation is as excellent that even if you are performing a living donor, any living donor has to be on the waiting list for 48 hours before it takes place by the regulation of our country, and people like Sergio will come and overview in your center that the papers are well, and that allowed us under the legal framework to perform related and unrelated transplants. And I think that this is an example that can be followed by many other countries. Thank you, Sergio, and thank you for allowing me to answer this question.
Okay, I'd like to thank everyone for their insightful comments. Thank you to the three speakers for their excellent presentations. I'm told that we're going over time and we need to close this session. It's been a very helpful and enlightening session. Thank you to all the presenters and all the people who made questions and comments. And thank you to my co-chair, Riadh Fadhil. Good night.